see Councilman Boylan and Lanen. Okay. Good afternoon. Good to see everybody. Thank you for joining us here today to kick off our new Mental Health Matters JAX initiative. As many of you may already know, mental illnesses are very common in the U.S. It's estimated that more than 1 in 5 adults, roughly 58 million people, live with a mental illness. Mental health matters. It is just as important as physical health for a person's overall well-being. For example, depression increases the risk for conditions such as diabetes, heart disease, and stroke. So it's imperative that mental health be included in any discussions involving the health of our citizens, not just in May during Mental Health Awareness Month, but year-round. Mental health includes our emotional, psychological, and social well-being. It plays a major role in how we think, how we feel, and how we act. It can determine how we handle stress, relate to others, and what kind of life choices that we make. So very, very important that we address this. And no matter one's age, mental wellness is important from childhood, adolescence, adulthood, and of course through senior living as well. Many factors can affect someone's mental well-being at any given time. For example, getting fired, working long hours, losing a loved one, or experiencing economic hardship. Those are some of the biggest reasons that people can be impacted and have mental health issues, have well-being issues. There are also many other routine causes that can take a toll as well. Mental and behavioral health illnesses have been an ongoing issue in the U.S., and Jacksonville is, of course, no exception to that. At 1,044 people for every 100,000, Duval County's hospitalization rate due to mental illness is 13% higher than the state average, according to the Florida Department of Health. With this growing need, we are launching 3 programs from the policy recommendations that our administration made and that City Council unanimously passed back in December. Each of these programs addresses a distinct mental health challenge. First, the United Way of Northeast Florida has reported, listen to this, a 75% increase in crisis calls to the 988 call center since just 2022. A 75% increase since 2022. Fortunately, they do a wonderful job of de-escalating those calls at a rate of 98.7%, and then they hand off the individual to the next appropriate level of care. Understanding the need for crisis de-escalation continues to rise. The city has provided additional funding to the United Way for adding additional folks. 2 additional crisis managers are going to be added to their team of 12. Second, the mental health crisis also involves our children, with pediatric and adolescent mental health an increasing concern among caregivers, educators, and healthcare providers as well. In fact, a national survey of 3,300 high schoolers conducted in the spring of 2020 found that 1/3 of students felt unhappy and depressed, much more often than not. Mental health issues in younger kids are also on the rise. Since the spring of 2020, mental health-related emergency department visits have increased 24% in children ages 5 to 11, and 31% for those ages 12 to 17, with 2019, according to CDC data nationwide. That's compared with 2019, rather, according to the CDC data. These ER visits could be mitigated with more widespread outpatient care, but kids often must wait months for appointments, with only 4% of U.S. clinical psychologists being trained in child and adolescent care. And of those who are trained, of that 4%, very, very few take Medicaid or any health insurance at all. This only makes wait times longer. So we're providing $430,000 in funding for Angel Kids Pediatrics, an organization that provides mental and behavioral health services for our youngest citizens while also addressing the social determinants of health. Their clinics are in underserved areas of our city. They are multilingual, and they always accept Medicaid. Third, and since mental health can affect all of us, it is important that the community at large recognizes the signs of mental illness and distress. To that end, we are launching Mental Health First Aid, a groundbreaking public education program that helps the general public identify, understand, and respond to signs of mental illness and substance use disorders. It will be managed, operated, and disseminated by the National Council for Mental Well-Being. This training program gives community members the skills they need to reach out and provide initial help and support to someone who may be developing a mental health or substance use problem or experiencing some other type of crisis. We're proud to support an organization that can help train an additional 1,500 community members on the signs and symptoms of mental illness. More information on each of these resources, as well as others, can be found on our new city website, jacksonville.gov/mental health matters JAX. So please take a moment to check out the site and please share it with your family and friends. This is an issue that we all need to get behind and pay attention to. Now I would like to welcome Council President Salem. He and I share a passion for health, and we have both made it a priority for our city. I am truly grateful for his leadership and support of these programs that I just mentioned, in addition to the council folks, all of them, and the ones that are here today, Council members Lanin and Council member Boylan. Thank you so much for being here. Council President Salem, I'll turn it over to you.
Thank you, Mayor. I must tell you a quick story. For the last 4 years of my time on the council, NAMI and someone very close to me, Prairie Pass, would contact me on Mental Health Month. And we held a little photo op before the council meeting in the atrium. Took a quick picture. We would have the proclamation from the mayor in front of us, and that was it. And this year, they contacted your office and said, this is what we've done in the past, and instead of doing that, this is where we are today. So it just shows a different emphasis, and I appreciate that. I also wanted to recognize my colleagues here at Boylan and Lane. Appreciate y'all coming. As president of the council, I'm honored to be gathered with you today as we address the important topic of mental health. This important topic is one that I wanted to focus on during my term as president. As you know, May marks the Mental Health Awareness Month, and it is time when we can come together and shed some light on the challenges faced by individuals battling mental health issues. It is also a time for us to reflect on the commitment needed to support their well-being. In Jacksonville, we recognize the critical role that mental health plays in the overall community health of our community. That is why I'm so proud to be a supporter of the Mental Health Offender Program known as MHOP. And I also should tell you, Mayor, this program was birthed when your cousin, Tommy Hazouri, was president. Just to continue that story, I know you'll appreciate this. Tommy called me into his office when he became president, and he said, Ron, I want to do something on mental health. Don't know what it is, but I want to get credit for it. You're good at this. Go find something so I can take credit for it. God bless him. So I'm going to talk a little bit about the Mental Health MHOP. This program is a groundbreaking initiative aimed at providing vital support and resources to those in need, and is being recognized on a national level for its positive impacts it is providing. In fact, Dr. Colleen Bell, who works at Sulzbacher, the psychiatrist over there, one of the most wonderful people you'll ever meet, is traveling New York City to receive an award from the American Psychiatric Association for her work on this program. Congratulations, Dr. Bell. Diverting nonviolent misdemeanor defendants away from the criminal justice system and into community-based treatment and recovery services allows us an alternative to conventional criminal justice processing and incarceration. This program not only saves lives, but it also saves money. MHOP presents hope for individuals grappling with mental health challenges. Through a collaborative effort with our local government, Jacksonville Sheriff's Office, State Attorney, Public Defender, and the courts, including Sulzbacher Center, MHOP provides accessible and compassionate care to those who need it most. Whether it's connecting individuals with counseling services, providing educational resources, or offering psychiatric treatment, medication, substance abuse treatment, or peer support and housing, MHOP is dedicated to making a meaningful difference in the lives of our residents. This work is not over, however, and we must be mindful that mental health requires our attention year-round. This month, let us commit to breaking down stigmas, fostering empathy, and creating a culture of support and understanding. Together, we can ensure that no one suffers in silence and that everyone has an opportunity to be successful. Thank you for your support and dedication to this important mission of our community. Together, we can build a community where mental health is prioritized, where support is readily available, and where individuals feel valued and supported. Thank you very much.
Thank you for those words, Council President Salem. And Mayor Deegan, thank you for your focus on health, but in particular mental health, because we all know that mental health matters, Jax. It really does. And for too long, we have put our mental well-being on the back burner, but not anymore, and certainly not anymore here in Jacksonville. The Mental Health Matters initiative is being kicked off in May during Mental Health Awareness Month, but will be something that we will continue to promote for weeks, months, and years to come. As the mayor stated in her remarks, we have a 13% higher hospitalization rate for mental illness compared to the rest of the state. We hear too often that people don't know where to go for help and that they can't find help in time. So we have developed a list of resources available in the community and will provide opportunities for folks to talk directly with experts who can help them find these resources during an upcoming phone bank that Director Lynn Sherman will share with you in a few minutes, and our wonderful website. I want to talk a little bit about the 988 number. How many folks actually know that there's a suicide hotline and it is 988? This number has been around since July of 22, yet a recent Pew Research poll indicates that only 13% of the adult population knows it exists and knows what it's used for. We need to change that, and change that here in Jacksonville in particular. The 988 Suicide and Crisis Lifeline, previously known as the National Suicide Prevention Lifeline, offers 24 hours a day, 7 days a week, call, text, and chat access to trained crisis counselors who can help people experiencing suicidal thoughts, substance abuse, and/or mental health crises, or any kind of emotional distress. Loved ones can also call, text, or chat these numbers for people that they care about who may be needing support. It is a confidential system as well, so you don't have to worry about other people knowing you called. It is an easy to remember number, 988, very easy to remember. And if you call 988, you can choose option 1 if you're a veteran, option 2 for Spanish speaking, option 3 if you need help from the LGBTQI support system. And once you call that number, 3 things happen. You'll be assessed with intervention, connected to resources, and have follow-up. So number 1, the assessment and intervention. You call 988, a crisis manager speaks to you and immediately assesses your situation regarding your needs and supports you until the crisis is de-escalated. Then they connect you to resources. Follow-up assessment, following the assessment and intervention, the caller is then connected to mental health resources here in Duval County for long-term follow-up. And then they will personally follow up with you a few days later. After the crisis has been de-escalated, the 988 specialist will call you to make sure you did go see the resource that was available and to see how you're doing and if you need additional support. All of this happens when you call that number, and it's handled locally. Can you text 988? Because our younger folks here in Jacksonville don't like to call and they don't like to talk to people. I mean, I communicate more with my kids by texting, even while we're sitting in the same room most of the time. But so they would prefer to text than to call. And yes, you can text 988. A trained crisis counselor listens to you, works to understand how your problem is affecting you, and provides support. Shares resources that are available as well. Texting is available in both English and Spanish. The LGBTQI community can text PRIDE to 988 and can be directly connected with someone who has background in LGBTQI related issues. Veterans can also text 988 and they will be transferred to reach a veteran crisis network as well. So why not call 911? That's always the question we get. Well, 911 operators have such an important role to play in our community, and for far too long, The response system has done its best to support people experiencing mental health crises related to suicide, mental illness, substance abuse, but the reality is that there are the best practices out there in behavioral healthcare systems are not really the way EMS is suited or equipped to provide. Because to keep in mind, if you are going to help someone through a crisis, you have to have the time to talk to them. It's about talking. When someone's having an issue, an emotional issue, a mental issue, talking is what leads to the de-escalation. And the best practices in the United States around the crisis continuum of care have found that as many as 80 to 98% of behavioral health calls can be resolved over the phone without needing to initiate 911 or the EMS. Does 988 really work? Well, it does, absolutely it does, and especially here in Northeast Florida. As the mayor said earlier, we are fortunate in Northeast Florida that the United Way does an excellent job of handling our 988 calls locally. In fact, they are able to de-escalate 98.7% of the calls. 98.7%, which means that only 1.3% of all of the calls that come through will have to be Baker acted or hospitalized. That is why we are strongly encouraging folks in crisis, or if they have loved ones in crisis, to call 988. Not only can you get the help you need at that time, at that very important moment, but you can also get set up for critical long-term follow-up care. So our goal continues to be to educate our community on the resources that are out there, in this case for mental illness, prevent hospitalization, and de-escalate crises when they occur. And as we do this over the years, as the years go on, we are hoping that more and more people understand and learn that mental health matters, Jax. Thank you, and I'll turn it over to Director Lynn Sherman, who will discuss how we'll get the word out. Thank you.
Good afternoon. As we stand on the start of Mental Health Awareness Month, it's crucial, as you've already heard, for us to recognize the importance of reaching out for support when facing a mental health challenge. Today, I'm simply honored to tell you about a powerful resource that the City of Jacksonville is, in collaboration with numerous mental health organizations and media outlets, is offering our citizens: a mental health information and resource phone bank. I met a parent who noticed her son was exhibiting signs of mental health crises. And that crisis included deep depression, profound. Concerned and unsure of where to turn, she reached out to the 988 crisis call line that a coworker told her about one day. With a feeling of nervousness and complete fear, she dialed the number anyway, hoping for guidance and support, with no other place to turn. On the other end of the line was a compassionate mental health professional ready to listen and ready to assist. Tomorrow, May 7th, from 7 a.m. to 7 p.m., our phone bank will be operational, providing you with direct access to mental health professionals who can answer your questions and help you identify resources for yourself and your family. Whether you're grappling with increased depression, anxiety, or suicidal thoughts due to life challenges, facing addiction issues, or simply seeking information, this phone bank is here for you. Our mental health professionals will connect you with a network of mental health organizations equipped to address your specific needs. From low cost to no cost clinical services and non-clinical resources, we will offer a comprehensive range of support options. Rest assured, all calls are confidential, ensuring your privacy and your comfort. But our commitment to supporting your mental health doesn't end tomorrow with the phone bank. I encourage you to visit the city's website at jacksonville.gov/mentalhealthmattersjax, where you'll find a wealth of local mental health resources and services and programs available to you this month and year-round. In times of darkness, it's essential to remember that help with it is within reach for all of us. Together, we can do this. Let us break the silence around mental health and embrace the support and resources available to us. Your well-being matters, and we're here to support you. Thank you, and we look forward to hearing from you tomorrow on the phone bank, and we look forward to you visiting our website at jacksonville.gov/mentalhealthmattersjax for activities throughout the entire month. Thank you.
Thank you, Sunil and Lynn. Appreciate that so much. We are so excited to be able to continue to partner on this and to offer these services. I think it is, if you take a look back at what happened when we were enrolling folks in healthcare earlier in the year, astounding success. And the common denominator here is simple education. This is not something that's costing us a lot of money, a phone bank like this, to connect people to professionals, to make them more aware of what is available to them, and hopefully to increase awareness as we go forward. This is just a first step. But I think, once again, it illustrates how much we can accomplish if we just take the time to educate people. The fact that only 13%, was it 13% know about it? That's a big deal. So obviously, all of these programs that you've heard discussed today are a wonderful step forward. And like everything else, we can't stop here. We have to continue to work to make mental health services accessible for our community, because if people can't be healthy, they can't be functioning members of our city, and that's what we want. We want everybody to be happy and healthy. So thank you for being here today. We appreciate it, and we look forward to the phone bank tomorrow. Anybody who has questions on this are welcome to ask. It's probably going to be Sunil or Lynn that will answer those questions. So if y'all want to come up for questions that anybody may have.
You talked about the 98.7% success rate. How do you determine that? What does it look like? What boxes are being checked saying this person has passed whatever threshold that we think they're going to be?
So the success rate is based on when somebody calls 988 and the crisis manager being able to de-escalate that crisis to the point where they don't need to activate the emergency medical services or have the person go to the hospital. So by de-escalating, that's a success, right, at that moment in time, and then getting them set up for follow-up care, long-term follow-up with mental health resources.
So even if they're de-escalated, then they still get that follow-up care?
Absolutely, 100. That's the most important part of all of this. Is it's one thing to prevent that immediate reaction. It's a completely different thing to make sure that person is taken care of after they hang up the phone.
Thank you.
Janice here,
Yes.
Channel 4. In addition to the three-pronged approach that's going to happen this year, is this something that will now be an annual thing with this administration, and will it be built upon for the years to come?
Talking about mental health awareness, absolutely. So this is the kind of thing that we don't want to do just in May every year, right? So that's why I was mentioning weeks, months, years to come. The website, when you get a chance to look at it, is going to be a living document that we'll be adding resources to, updating resources. We actually have a mental health committee that helps Lynn and I do our work on a regular basis, who will allow us to update those resources as well. And so this is something we're going to be doing ongoing, and we hope that this is something that the city of Jacksonville will take seriously.
Do you have the number for the funding for tomorrow?
Not yet. We don't want to share the number until it's time for the phone bank to open, because we don't want people calling that number when it's not functional.
Thank you, everybody.
All righty, thank you.